Our research is embedded within a population-based study in Rotterdam, in the Netherlands. This is a study which has been following about 15,000 people now in a suburb of Rotterdam, and most of the people have been included from 1990 onwards. So over the past 25 years we've collected data on their health outcomes and various measurements. For this study in particular, we were interested in the value of parental family history of dementia in relation to the risk of developing dementia. So we have looked at the risk of dementia if either one of the parents of the participants were affected by dementia. For this, between 2000 and 2002, we have interviewed a little over 2,000 participants of our study about whether their parents were diagnosed with dementia at some point. And we followed these participants up till 2015 to see whether they have developed dementia themselves. We looked in particular whether the age at onset in the parents was of relevance to the risk of developing dementia, because we know that family history of dementia is an important risk factor for developing dementia, but we're not really sure if the age at onset in the parents is of interest. And we know that that's of interest, for instance, in myocardial infarction and cardiovascular disease, but we wanted to investigate whether the same applies to dementia. And what we saw that indeed, independent of the known genetic risk factors for dementia that we know, family history of dementia is an important risk factor, and this was a particularly important risk factor when the age at onset in the parents was younger, and what we found in our study below 80 years of age. While there's still a large part of the risk associated with the family history that's unexplained by currently known genetic factors, and that's why we also try to investigate further in what could possibly explain this risk. So of the 2,000 participants, a little over 1,000 participants underwent brain MRI scanning at our center, and what we found on these MRI scans is that having one or both parents affected by dementia at below the age of 80 was related to more disease in the small vessels of the brain. So this might be a potential explanation for part of the genetic risks we don't have identified yet. Well, part of course, of the ongoing work is focused on the identification of new genetic risk factors. I think in particular for this study it's also important from a clinical perspective for doctors to be able to inform patients and their relatives about what the risks are that are associated. So we wanted to inform clinicians with the study as well as perhaps researchers to select participants for their future studies. I think we are the first study that has observed these risks by age of onset in the parents. I think it is important also for clinical studies to see what the value of these questions and inquiring about the age of onset is in their populations, to be able to better inform patients about subsequent risk when they visit clinics. In addition, the abnormalities we found on brain imaging still only explain part of the genetic risk that's associated with having family members affected. So I think there still remains important work to be done to identify other factors with different types of brain imaging, and perhaps also with blood and CSF markers. Yeah.